medicine 的先驱，然后他应该是从可能我还非常小或我还没有出生的时候就已经在这个领域。那时候的人大部分不相信说饮食跟生活形态是可以改变的。那所以他是一个非常早期就开始从事。那如果他的Doctor of Health Science， 也就是这个健康学的这个博士，也是从 Loma University 拿到的。那之后他在美国的国家卫生研究院，就是 NIH 呢，做这个流行病学 epidemiology 的 postdoc。那之后呢，他当然又回到 Loma 去教书，教这个 Preventive Medicine。不过他非常有名的就是当初呢，有一个在美国有一个 Pritikin Center， 第一个以 lifestyle 的这个方式呢，去改变很多病人。那很多都被医生宣告是无救的情况之下呢，透过饮食跟生活形态的改变呢，就完全好了。本来有的只可以再活1年的，医生告诉他只剩下1年的。那因为透过这个饮食生活形态的改变，又活了20几年哦。所以是在美国有非常多的这个结果。那因为这些事情非常的有名，他们建立了一个CHIP program Comprehensive Health Improvement Program， 就是完整的生活形态的这个改变的一个课程。那已经有非常多的人介入，他们甚至在 community， 就是在社区里面一次几百人甚至有的是上千人的这样子的介入。那4个礼拜之间呢，有一个非常大的改变。我觉得这个是非常非常值得我们学习，所以我们真的非常荣幸可以邀请到在做社区方面这么有经验的一个讲師。大家跟我一起欢迎 Dr. Diehl。
I don't know what she said, but I heard my name, so I figure I must be speaking here now. I'm delighted to be with you here and to see the interest in an enlightened way of living, where we take more responsibility for our choices, and with that for our health, for our globe, for our planet, and even show more compassion towards our animals. I want to make some concepts here available to you that could bring much more joy into your professional lives when you treat diabetes. Type 2 diabetes. If we would make some adjustments in our nutritional therapeutic recommendations, we could take a disease that when diagnosed often appears to the patient as being a death sentence. But if you make some adjustments in how we prescribe and what we prescribe dietary-wise and exercise-wise, we can turn the majority of diabetes off in 4 to 12 weeks. People on insulin, people on medications, oftentimes see an immediate, within 3 to 4 days, a reduction in insulin, a reduction in pharmacological agents in very rapid order. And if you can help them to sustain this new lifestyle, it will bring great professional satisfaction and joy to your heart. Are you interested in that? Okay, good. So, let's start. Reversing type 2 diabetes with fork and knife. And remember, I didn't say preventing, I talked about reversing the disease. This is almost heresy, but it's not. The data is very strong. We had data for over close to 100 years, but somehow we've forgotten this. So here are some of the things. I want to talk basically about what we know about diabetes, then what we should perhaps take a look at in understanding the etiology, what's causing it, and then perhaps look at some of the great opportunities that we have and what we can do. And I'm delighted that Dr. Deisinger made the presentation on macronutrients and micronutrients so that I can build on these kind of things and we can cover some of the other aspects quite nicely. So we want to perhaps understand the emerging epidemic. We want to do something about understanding the reversal of the epidemic, but it requires a new understanding of the diet, which has today been based on shifts in our cultures. In our cultures, we have gone from whole foods to refined foods. We have gone from plant foods, largely plant foods, to animal products, largely animal products. And we have gone from low calorie intake to high calorie intake because of these refined foods and animal products. And number 4, we have gone from low fiber content to high fiber content, and we have shifted from a high complex carbohydrate diet, unrefined foods, to a refined complex carbohydrate diet. Are you with me? So we have made some tremendous shifts in our diet, and we perhaps need to be aware of these kind of things. Diabetes, here's the alarm. It's estimated that every second American adult either has diabetes already or is a pre-diabetic, with 30% becoming a full-blown diabetic within 3 years. Now you say, you're talking about America, this is Taiwan. Taiwan is becoming, in many ways, an America in terms of the cultural and especially dietary lifestyle norms. So maybe while I'm talking about America, perhaps it might be applicable to your situation here more than you would like to think sometimes. Of course, we all know that about 90% of the diabetes that we have relates to the type 2 diabetes. When I went to school, we were told, look for a diabetic when a person is over 60 and large, fat. Today we're looking at type 2 diabetics when they are 30 years and 20 years and 16 years and carrying extra weight. So diabetes, here's the prevalence. It has been doubling every 15 years, and today a newborn baby in America can expect to be 1 out of 3 that will develop diabetes in a lifetime. This is pretty scary. And we have no medical cure. We have some symptomatic relief, we can control some of the blood sugars, but we have no cure. But there's a cure. Now what do you see here? What do you see? You see, the chairs have been pretty much stable in their width, but something happened after 1985. Something happened. And you know, American people in particular, and people around the world are becoming larger and larger and larger. And when you have a very obese population, this is now extreme obesity, BMI over 40, the chances of diabetes is 700% higher. So diabetes, type 2, and obesity, they're sort of cousins. And it's not only the aspect of diabetes and obesity being related, but also diabetics usually have to give up, on the average, 10 to 14 years of life. So you shorten the life expectancy of people because of the diabetes and its multiple complications, particularly in the cardiovascular area. We also recognize that diabetes is directly related to the atherosclerotic diseases, circulation-related diseases. It is one of the accelerating factors that promotes cardiovascular disease. So diabetes has a devastating effect in terms of accelerating multiple diseases. And here you see what we're talking about. You're looking at a circulatory system where the atherosclerotic processes can affect the cerebral arteries, the carotid arteries, the coronary arteries, the renal arteries, the femoral arteries, the penile arteries in men. And then these arteries, while they basically relate to one basic underlying problem, and that is systemic atherosclerosis, these diseases then begin to take on a new life. They take on a new treatment. We have many different specialists that try to take care of these different diseases. It's really only one disease. And if we could take care of that one disease, the underlying atherosclerotic process, we probably would have a much better chance in taking care of all the different diseases that are relating to the atherosclerosis and the inflammatory processes. And so when you recognize that diabetes accelerates atherosclerosis and inflammatory processes, then we shouldn't be too surprised that it is the #1 cause of blindness. It is one of the top causes of kidney disease. It is increasing heart disease and stroke by 2 to 4 times. Impotence in men is oftentimes the first sign of underlying deterioration of the circulatory system. And then you have foot and leg amputations, #1 cause, diabetes and the complications and hearing impairment. So diabetes is really devastating because it relates to atherosclerosis and it accelerates these disease processes. And yet we know that 80% of the diabetics die from atherosclerosis-related diseases, and we very oftentimes just focus on the management of the blood sugars instead of dealing with the cardiovascular risk factors, which are indicators of the emerging complications. We know that based on the blood sugar levels, we can expect a certain amount of tissue damage. The higher the blood sugars over a prolonged period of time, the higher the likelihood of nerve damage, vision loss, and so on and so forth. And on the other side, when we begin to reduce the blood sugar levels with diet and exercise, we can also dramatically reduce these complications affecting the tissues. This is very, very important. You can actually do something about neuropathies, for which we have basically in medicine no answer. We can reverse some of these complications. How do we treat diabetes? The traditional medical approach is usually to deal with the pharmacologic agents. And you can see here that 62% plus 14%, 76% plus 10, you have now, you have some 85% of what we do has to be done with insulin pills or combination of insulin pills. And then we have another 3 million or 14% where we give a diet. And what do we prescribe for diabetes as a diet? What do we usually do? What's the kind of diet that we prescribe? We have some dietitians here. What do we do? We usually prescribe a diet that's fairly high in protein, lean protein, at least that's what we do in America, because we have the idea that you cannot handle carbohydrates, right? Because starch turns into glucose, right? So therefore you cannot use too many carbohydrates. We know that fat is not in the best interest because it creates overweight. So what's left to eat? Protein. So oftentimes we prescribe a lean protein diet, lean meats, chicken and so on. And it only exacerbates the advance and the promotion of renal disease because the kidneys are now being overburdened. And so we need to find a new approach. We recognize, especially when you're in the medical treatment field, we recognize that these medications, like most medications, they always we have to deal with side effects. We have to deal with economic issues. We recognize that when it comes to chronic diseases, usually most drugs do not cure, but they kind of provide some relief, symptomatic relief to the patient. So these are helpful, but they're not curative in that sense. And furthermore, we have to recognize that all of these medications for the diabetes treatment, except for one, they're all promoting appetite. So what happens? So you take the medication, you take the insulin, it enhances appetite. As a result, you gain weight. As a result, your blood sugars go up. This demands now that you take more insulin. The insulin now again enhances appetite, and the vicious cycle continues. So people that we put on 10, 20 units of insulin, they go to 50 units, to 100 units, to 150 units, to 200 units. You have not really cured. In some ways, you have made the disease to progress. And so we need to have, I think, a new approach. And I want to propose that to you. We have to go beyond just mopping up. What do you see here? There's some very well-trained people. They're doing everything they can to keep the floor dry. These are the Western diseases. These are the chronic diseases. We're working very, very hard to keep the floor dry. But what we really need is a plumber. We need someone that takes care of the cause. What are the causes? So how can we go beyond just providing symptomatic relief? What could we do? Well, this was a recent article that suggested that exercise and diet must be the foundation of treatment. This came from a medical article, a summarization, and they recommended that we need to have a comprehensive risk reduction when it comes to the cardiovascular factors. When you do something about blood pressure, when you do something about the lipids, you do something about exercise and so on. However, the Diabetes Care article said, providing the needed education to these diabetics when a physician has only 7 minutes time per patient is really very unrealistic. In other words, we can't do it. Now, in America, we have about 10-15 minute time slots for seeing a patient, and half of that time we are spending in entering the data into the computer. So we end up with 7 minutes. What can you do in 7 minutes? You heard Dr. Dysinger talk about the idea of a complete, comprehensive nutrition, lifestyle prescription. You can't do that in 7 minutes. And the patients are being oriented toward those kind of things. I want you to eat this, I want you to eat this. Just let me get out of here. So we need to have either a change in how we practice medicine, or perhaps we need to have a stronger team where we have dietitians that can help us. Because dietitian can see patients for an hour. And here's another recommendation. Maybe we shouldn't see patients one-on-one as dietitians, because they all have the same problems. Why don't we put them in a group? Why don't we do an initial workup, we understand what this patient is all about, and then we see if we can integrate them into a group of 5, 10, 15, 20 people. That's what we do with the CHIP program, the Complete Health Improvement Program, where we have from 10 to 500 to 1,000 patients, because all of them have pretty much similar disease entities because they're systemic diseases. It would be very effective economically, and the patients help each other. They develop friendships, so it becomes easier down the line to stay on the program. Are you with me? Okay. So I want to take you to Loma. This is where the three of us come from, and we are just so delighted to have this special young doctor here, a graduate of Loma some time ago, to give me an excellent tour here of your lovely city. Okay, Loma, large medical school, schools of public health, dentistry, and so on. They are known also for the highly respected large population study on Adventist health. Adventist people are sort of conservative people. They have a certain lifestyle. They go to church usually once a week. They usually don't use alcohol. They don't smoke. They're pretty much a similar lifestyle, except they're different in one area. Half of these Adventist people, these are Christian people, half of these people are meat-consuming people, perhaps less than the general population, but they're there. 10% of these Adventists are fish-eating vegetarians, 31% are lacto-ovo-vegetarians, and 9% are very pure vegetarians. And so the government provided a major grant to the university and said, look, you have over 1 million Adventists in North America. Why don't you enroll about 100,000 Adventists and you follow them for 7 years as a prospective study and tell us who is doing better than others? Can we learn something from you? Because you have no confounders anymore, because all of these Adventists don't use alcohol. All of these Adventists don't smoke. All of these Adventists have a support system. All of these Adventists usually go to church. So you have a similar, homogeneous lifestyle, except in the diet. Here's what they found. When it comes to diabetes, the meat-eating Adventists have about 4 times more diabetes than the pure vegetarians. So if you don't want to have diabetes, perhaps the green color might be attractive. And if you say, well, I just want to have a little bit of diabetes, maybe you can just go become a fish-eating vegetarian. You can choose. This is what the study is telling us. So let me go beyond the Adventist population study. Let me go to take a historic view. Japan. We could take different populations. When people are on a very simple diet, foods as grown, whole foods, it's usually very difficult to find high rates of diabetes. Japan, 1960, 1% of the adults over 40 years old had diabetes. Today it's over 15% of the adults. What happened? Did they change the genetics? It probably takes 300 years to change the genetic of a society. This happened in 40 years. Diabetes is not a genetic disease. If there's a genetic component, and there probably is, it doesn't have to express itself. And that's why the first presentation this morning was so very important, that people realize we can do something about it. We are not stuck with our genes. In Japan, we see a dramatic decline in carbohydrates. In the process, we also see an increase in fats. Now, with the decline in carbohydrates, which are so bad for diabetes, would you have expected a lowering of diabetes? And this introduces now the very important question: how could this be? Could it be that there are different kinds of carbohydrates? Could it be that there are simple and complex carbohydrates? And could it be, more importantly, could it be that there are refined carbohydrates and unrefined carbohydrates, and they act totally differently in the body? Here you see the increase in diabetes and the increase in obesity. So this confirms and strengthens the idea that obesity and diabetes are cousins. They're running parallel in motion. So let me go to shift number 1 in the US. This is the amount of empty calories in our diet, no nutritional value, sugars, fats and oils, and alcohol make up 44% of the calories that we eat in America. This is an embarrassment. I mean, we should know better than that. And so we are becoming one of the first countries where people are overfed and undernourished. Shift number 2. We have shifted over the last 100 years in the consumption of animal products. Today we have almost doubled the amount of animal products, particularly from fowl, from chicken. And for some reason, chicken has sort of a superior ranking. We say it's white meat. Well, the amount of cholesterol is exactly the same in chicken as it is in red meat. If anything, it's more. Chicken used to be, when it was running around, free, roaming around, those chickens usually have lower fat intake, but today they're raised in confined factory farms, and the fat content of chicken has dramatically increased. So some of the advantages that may have been there have been significantly reduced. This is perhaps the most important slide. This is a poor farmer in the southern part of Taiwan. He can hardly make a living. Most of the calories come from green color, starch. The farmer lives on a high complex carbohydrate diet. What do they eat? Help us. White, right? Sweet potatoes, yams, potatoes. Okay. What are the cereals? Do they have grain? Grains? No wheat? Rice. Okay. So you have a diet that's very high in complex carbohydrates that are usually unrefined, which means this is a diet that's very high in fiber. Okay? You say no? I beg your pardon? I understand, but you don't only eat rice. You have sweet potatoes, you have other things too. No, you only eat rice here in Taiwan, the farmers? Okay, I'll let you be the expert. So, you go from a diet where you have minimal amounts of fats, minimal amounts of sugar, and you have almost enough protein, but it usually comes from plant sources. This is a traditional diet 100 years ago. I checked it out a little bit. Then the farmer now says, I want to become a supporter of my family. He moves to Taipei, becomes a computer programmer. Now, he no longer eats homegrown foods, he eats foods out. He no longer eats slow foods, he eats fast foods. He no longer eats beans, he eats burgers. He no longer eats potatoes, he eats potato chips and Pringles. He no longer eats mangoes, he eats now sweet things. And the grains that he used to have, they have now turned into Oreos and sugary treats. And the water he used to drink now has become soda pop. And the man who used to be slim now becomes large. Dietary shifts. This is the American diet. 50% of the calories comes from refined foods, 35% comes from animal products, and only 14% comes from the foods that Dr. Dyson recommended, right? He said fruits, whole fruits, vegetables, whole grains, and legumes, and maybe some nuts, right? This has become a minority portion in the diet of society as the income increases in society. So you have these refined carbohydrates. Please, this is very important, refined. So you have processed starch that turns into sugar, no question. Without fiber, refined carbohydrates are unprotected. They can be broken down and absorbed very quickly. That is where we get the idea from, that starch turns into sugar. Refined starch turns into sugar. White flour turns into sugar. It doesn't take very long, 15, 20 minutes. Please also note that this kind of a diet only contains about 10 to 12 grams of fiber. So this is a very low fiber diet, which protects the carbohydrates actually from being absorbed so quickly. So what can we do? This is an article that came out last week. This is looking at the dietary factors and the mortality from cardiometabolic, that's diabetes, diseases. And this major article suggested that probably some close to 50% of our diabetes mortality could be avoided if people would eat more fruits. Fruits for diabetics? Is this heresy? Can diabetics eat fruits? It has sugar, doesn't it? But it's the packaging. It's packaged right. It's whole fruits. We're not talking about fruit juices. We're not talking about jams. Number two, they said double or plus the amount of vegetables and legumes. Beans, with its fiber content, are a royal therapeutic agent of the highest order in taking care of diabetes and beginning to reverse the diabetic process. Beans. Part of the top, the dozens that we talked about. They recommended to increase nuts and seeds. We eat very, very few nuts and seeds in America, and so we would like to double this, but it should be done within reason because nuts are relatively high in fat content, so we want to eat them in moderation. And then they increase, for the treatment of diabetes, increase whole grains by 6 times. Did you notice I raised my volume? My voice? This is heresy. No, it's not. This is whole grains that are protected by the fiber content. It's a diet that will also be high in fat, because if you eat more carbohydrates, whole complex carbohydrate foods, then automatically you reduce the fat content. And you also become more moderate in your protein consumption. And when you reduce your protein consumption, which is nowadays mostly from animal sources, you also reduce the amount of cholesterol that you take in, and the saturated fat, which has a powerful effect apparently now on diabetes 2 and affecting the beta cells. And then they recommend to take care of diabetes and heart disease, we should really reduce red meat. How much do they recommend? They recommend 3 ounces. Now 3 ounces, that's 100 grams of meat a week. Notice I raised my voice? This is heresy. And yet that's what Loma has taught us, and many other population studies that move towards a plant-based diet. I mean, the evidence is screaming at us that we should take it seriously. And then they recommend, what about processed meat like sausages? They recommend 0 because of the danger of cancer, which is similar to the cancer that you can develop from smoking. So these are some interesting things. Let me just go a little bit further. You're all familiar with this, how the body works. You have cells, you have surrounded by a circulatory system, and you have insulin, which is then opening up the locks to these cells, and the glucose that is surrounding the cell can get into the cell where it is needed. That's how it works, usually. But then when you don't have a pancreas or it's not working properly, then you have type 1 diabetes and you now have to rely on insulin from the outside. And that can work really well. Then you have what we call type 2 diabetes, and here you have a pancreas that's really active. That pancreas is working overtime. It has a lot of insulin. This is not an insulin deficiency like type 1. This is excess insulin. But the insulin, for some reason, cannot open up all these gates. The locks are gummed up. The key goes in, but it doesn't turn. We talk about insulin resistance. And so after a while the pancreas is pushing out more and more insulin, it after a while becomes tired and exhausted, and a person becomes sort of like a type 1 diabetic. It no longer produces insulin because it overextended the pancreas. So let me just go quickly over some of the concepts of how we can create diabetes. Do you know I can take medical students, I can take 50 medical students, they're lean, they're young, they're active, and I can take those 50 medical students, and within 2 weeks I can produce 70% of these medical students into diabetics. They've done it. They did this in 1927. Here's what they did. They gave these students a very high-fat diet. The American diet is about 34%. This is 65%. This is a very, very high-fat diet. And the students just loved it. Hash browns and salami and cheese and cream and butter and anything slippery. They just loved it. Besides the fat, there was not much more to eat, right? This is a very high-fat diet. And then they had a control group. They took a control group and they gave the control group sugar, pastry, candy, white bread, bananas, baked potatoes, brown rice, just the opposite, right? Guess what happened? The experimental group on a very high-fat diet, within 2 weeks, 70% had developed transient diabetes. The control group, difficult to find diabetes. With all the sugar, they provided them with 1 pound of sugar a day, with the foods. And we are now asking the question, come on, this cannot be right. And we all know that sugar, the carbohydrates, simple carbohydrates, they're causing the disease. How come after 11 weeks not one medical student tested diabetic? There's something wrong. They must have done the study wrong. Well, there were other studies. 1935, Sir Harold Himslow, a very well-known diabetologist in his day, he was able to create diabetes with a high-fat diet. The amount of fat in the diet determined the amount and the rate at which diabetes could develop in his population. I can take you to some of the newer studies. This is now in Colorado. They took 134 pre-diabetics, followed them for 3 years, and they found that nothing was more powerful in turning these obese pre-diabetics into full-blown diabetics. Nothing was more compelling than the amount of fat in the diet. Those patients who had, on the average, about a 40-gram increase in fat increased the risk of diabetes by 60%. So there's a relationship between fats and diabetes development. Harvard, 85,000 pre-diabetics, followed for 16 years, 3,000 become diabetics, and they find that 91% of that related to their lifestyle, especially obesity and their diet. Particularly when it comes to the weight issue. The highest weight versus the lowest weight was a 40-fold relative risk. So management of weight becomes a very critical issue when you have to deal with diabetics. Then you have the famous DPP study. This is the diabetes prevention program, and they compare metformin versus lifestyle. And this is a fabulous study here. Please note, there's some 3,000 obese pre-diabetics. They're in many centers around the country, 27 trials centers, and they find out that within 3 years, about 30% of these pre-diabetics turn into full-blown diabetics. So 30% become full-blown diabetics. Those on metformin, only 21%. It helps. Yes to metformin. doesn't really have the side effect of causing appetite enhancement, which is a good thing. So 21% versus about 29%, but then they put these people, the other group, on a lifestyle program, very, very modest lifestyle. I mean, it's not what Dr. Dysinger talked about, intensive education. This was just, we want you to walk every day, it's 150 divided by 6. I want you to walk every day, half an hour a day, and we want you to lose about 7% of your weight. That's all. This was not the program that we use. This is a very weak program in comparison. But even this modest lifestyle change dramatically decreased the amount of the number of people that turned into full-blown diabetics. So the lifestyle, even this modest lifestyle, was more powerful than the metformin. Then you have number 6. These are, you have 200,000 people followed for 10 years, and they found that meat is apparently associated with the diabetes development. As little as 2 ounces, that's about 60 grams of processed red meat a day increased the diabetes by 50%. When they replaced it with the whole grains, the diabetes conversion from pre-diabetic to full-blown diabetic decreased by 35%. Again, making the point that maybe there's something that we need to think about when you shift from a diet that is very high in fat, like meat. We're talking about basically meat, probably. It could also be that the meat in itself, the animal protein, might have an effect on the beta cells. We don't know that yet. But here again, some of the best diabetes specialists that we have in America made that comment many years ago, and he said we can reverse diabetes because 50 to 75% of type 2 diabetics on insulin and 80% of those on pills could normalize their blood sugars and be off medication within weeks if they change their diet. What kind of a diet should it be? Let's take a look. This is the second most important slide for you to think about. The other one, of course, was dealing with the kinds of concept that when you go from this kind of more natural diet towards a highly refined diet, where now the diet consists largely of fats and oils and grease, lots of sugars, and whatever starch we eat now, it's usually white flour products, refined starch, and then you also have an increase in animal protein and protein in general. Whenever you go from this kind of a diet composition to this kind of a diet composition, you always find within 5 to 10 years the emergence of what we used to call Western diseases or chronic diseases. Japan, classic. China, classic. When I was in China in 1980, it was difficult to find high cholesterol. It was hard to find heart disease. It was hard to find diabetes. Now it's everywhere. So the diet has a very powerful effect. And then when you don't exercise, you have stress, you don't sleep well enough, you can see you have an accumulation of factors that synergize this disease process. Now let's go back to where we were earlier as we are beginning to go to the last phase here. This is the second most important slide. Please note, sugars are okay for diabetics as long as they're packaged correctly. Because there's something called fiber that slows down the conversion of carbohydrates into blood sugar levels. Refined sugars, totally different. When you have whole foods like complex carbohydrates, this is working very, very well in diabetics, but the moment you refine them, you're removing the fiber, and these carbohydrates now become very rapidly turned over into blood sugar levels that you cannot handle in another proper way. So, we talked about 3 shifts. We talked about the shift from whole food to processed food. We talked about the shift from basically plant foods towards animal product-centered diets. And then we talked about shift number 3. With that, we had a dramatic increase in the calorie consumption. With that, you always increase the likelihood of obesity and diabetes. And then the fourth shift is the shift in fiber intake. We used to have about 10 to 12 grams of fiber in the diet. That's what we have now. Refined diet. Meat has no fiber. Cheese has no fiber. Oreos have no fiber. M&Ms have no fiber. Kit Kat has no fiber. Cheese has no fiber. Okay. But today, we recommend that we should have about 40 to 45 grams of fiber in our diet. When you do this, there's a magic that takes place, because when the fiber comes naturally with the food is being digested and absorbed much slower, and the body can handle that perfectly well. It doesn't have the over-stimulatory effect on the pancreas that sugar has. And so you level off the insulin levels quite nicely. I think you can read this. Unprocessed starch, the food as it comes in nature, is protected by soluble and insoluble fibers. That's why beans are so important, because of the high insoluble fiber. Plus, it is very, very low in fat. It has no saturated fat. What we recommend, and we have seen over 80,000 people in our CHIP program, and about 12% of these are type 2 diabetics. What we have found is that when you increase the carbohydrates, unrefined carbohydrates, unrefined, from the usual 25% to 70%, your body begins to respond beautifully. Reversing diabetes, we have shown this over and over again for the last 70, 80 years. I'll just give you one example here. 1955, this physician took 80 patients on insulin. He put them on a very, very low-fat diet, whole foods, basically plant-based, and 50 of these insulin-using diabetics were off insulin in 6 weeks. Remember I said to you earlier, you can do between 4 and 12 weeks. The data is there everywhere. I can give you study after study. We'll just let go in reviewing them in detail. 74% of patients with type 2 diabetes on medications able to leave the center drug-free within 4 weeks. All they did, eat a very simple diet of foods as grown, foods as they come in nature, plus exercise. And they're off these medications in 4 weeks. We have now 5 books written on reversing diabetes. This is no longer a dream. This is documented. Here's the study by Dr. Neil Barnard. 71% of patients with type 2 diabetes could stop their medications in the 26-day program. This is a CHIP program here. That's what we run. We had some 525 diabetics, not on medication yet, but they were diabetics by definition. And after 4 weeks, there were only 301 diabetics. So 43% no longer classified as diabetics. So this is the CHIP program then, fork and knife. Low in fat, no cholesterol, high in fiber, plenty of legumes, high antioxidants, phytochemicals, low calorie density. You can eat as much as you want, you'll be okay, because the fiber constricts you of how much you can eat calorically, and the excellent, the adherence was excellent to the program, and of course a very, very low cost program. I want to show you a film, and we close with that. It's a 9-minute film. Let's see what we can do here.
A story from my practice. We'll be hearing about the health benefits of a high-fiber diet in a 76-year-old woman with multiple lifestyle-related diseases.
It had started several years ago, maybe 25, 30 years ago. I began gaining weight. That's the first thing I noticed. And with that weight gain, I developed some high blood pressure. And soon the doctors were talking to me about high cholesterol. And not too long after that, I started to develop what I thought were cardiovascular symptoms. I was very, very tired. I couldn't walk very much of a distance before I had to sit down. I would be out of breath. Very soon after that, I developed symptoms of diabetes. After several years of that, I started to have even more complications that come with high blood pressure and diabetes. I started to have eye problems, what they call diabetic retinopathy. So I did go to a nephrologist, and he suggested that my kidney function tests indicated that I was going into kidney failure. In fact, I was at stage 4, which sort of puts you right at the edge of needing dialysis and or a kidney transplant. Finally, one Sunday, I lost vision in my right eye, and at the same time had a problem with my right arm. There was some pain there, and I couldn't use it very easily. So then they ran more serious tests and finally did an angiogram. And at that time, they found many, 7 or 8 blood vessels that needed to be replaced, and then went out to tell my husband and daughter they would have to do open heart surgery and take veins from my leg and replace those blocked blood vessels in my heart. And they did that in short order. In addition to what I saw as very serious health problems, I did start to develop some digestive problems along the way. And I took some over-the-counter type medications for that, and it didn't seem to help much. So by the time that I made an appointment to see Dr. Greenlaw and talk about the colonoscopy, I also had many other digestive problems to discuss.
Now I would like to tell you about the medications that Beverly was taking. She was on 4 different medications for high blood pressure. One of them causes potassium to be lost from the body, so she was also taking a potassium supplement. In addition, she was on a trial of Lipitor for cholesterol elevation. Let's focus for a moment on Beverly's diabetes. She was insulin dependent, not only taking long-acting insulin every day, but several times during the day, she required injections of regular insulin to control her blood sugars. And remember, she had complications of her diabetes.
I had so many things that I really didn't know what to work on next to try to keep under control. I was so worried about myself and how I was feeling and what I was going to do if this thing progressed, or if I couldn't get those kidneys under control, or if the veins that they had replaced the arteries with in my heart blocked again. So I really was in a hopeless situation, and I knew I had to make some firm decisions and life changes.
In our discussions, it was obvious to Beverly, and it was obvious to me, that she had exhausted all the traditional medical interventions that could help with her diseases and complications. She was asking me, what could I do that would improve my situation? Now, we talked about lifestyle change, her nutrition, her exercise, what stresses were going on in her life. And could she make some changes that might begin to address her diseases? And she was interested. I recommended that she try the CHIP program, and she agreed. As Beverly and I talked about lifestyle change, therapeutic lifestyle change, we talked about her multiple diseases and how the CHIP program could address all of those. The idea that if you treat one problem with a lifestyle change, you begin to treat all problems simultaneously that are lifestyle related. And that seemed like a perfect idea for Beverly's situation. Now for the really fun part of this story. Beverly signed up to take the CHIP program in September and October of 2009, and I would like to share with you some of her laboratory data. In the beginning, her cholesterol was 263, and after the CHIP program, it was down to 170. When we looked out 5 months later, it was 202, and a year after that, 178. It is not unusual for people's numbers to improve with some ups and downs over time, and she has continued to improve. Notice her weight loss at the end of the CHIP program was 15 pounds, 5 months later, 25 pounds, and then in February, a year later, 40 pounds off. June of 2012, 57 pounds off, and that's where she leveled out. Notice the dress size going from 18 to 16 to 14 and then 12. And now she's shopping in the size 8 to 10 rack.
And I noticed that I could eat a great deal without taking more insulin. The other thing I noticed is I seem to be losing weight, eating more, but losing weight. And that gave me some encouragement. I think probably just in the first weeks, I lost 10 pounds or more. As I became more involved with the program, I noticed that I could get the blood sugar levels under control. That was a big thing for me. And I was feeling a lot better.
The big story here is that she's off insulin and controlling her diabetes with metformin and lifestyle change alone. And let's not forget that Beverly was suffering from severe complications of her diabetes. With the taking of the CHIP program, the laser treatments stopped. And over the next 2 or 3 years, not one laser treatment was necessary. Her ophthalmologist was stunned at that result because that is so seldom seen in traditional medicine.
Then the neuropathy. That was a problem. In the auditorium where we had our CHIP program, there were steps. And every time we went to our seats or got up to get water or have a break, we would use those steps. And I needed help a lot of the times because I couldn't feel the steps. The steps themselves in my feet, with my feet, if I couldn't see them, I wouldn't know they were there. And so someone noticed and gave me some help when I needed to get up out of my seat. And now it's so different because even if I change socks and I have heavier socks on or lighter socks, I can feel the fibers in the socks, and it was something I couldn't feel before. Just recently, the doctor checked my feet with the little wire to see how your neuropathy is, if it's progressing, and he could find no evidence of it at all.
Neuropathy is something most people would say is not able to be improved by medical therapy. You would use pain medicine to control the discomfort, but you would not expect neuropathy to go away. And in Beverly's case, her neuropathy steadily improved till it is now no longer an issue in her life. Incidentally, her heartburn improved within 2 weeks of starting the CHIP program.
I would have been happy before I started CHIP if any of the diseases that I've talked about would have been helped, even to any degree. That's how desperate I was. And now I see that not only the diseases were, some of them reversed, all of them improved, that's for sure. But it changed me as a person. I see myself sort of as CEO and president and chairman of the board of all the decisions that are made for my body, and do everything I can to make the right decisions day by day.
Wouldn't it be great if we could stimulate you folks to take the CHIP program and put it to a test? Would it work in Taiwan? It's all on videos. We train you in a couple of days, and you could do a fabulous research project here, where you would have the dietetic community and the medical community joining up with your research department, and take 100 diabetic patients and see the outcome as you take 50 the usual care, and then you do 50 with a program that is now modifying the amount of and the kind of carbohydrates. The magic comes from unrefined, complex carbohydrates high in fiber. You couple that with an exercise program, and with this kind of a dietary program, you cut back on your fats, you increase the antioxidant effect, and you see the synergy developing in patients where within days they will notice that their blood sugar levels are going down. And they'll give you a big smile. And they say, you have saved my life. And it has restored the joy in practicing medicine for the reasons that we're into medicine, to turn the diseases off, to reverse the diseases instead of making people lifelong users of medication. Thank you so much.
非常的谢谢Dr. Diehl。